The typical physical therapy assessment looks at range of motion, strength, functional movements, and balance. These are all great tools to have during the evaluation. However, there's one key underrated and neglected measurement that we're missing. This measurement is the infrasternal angle. And in this video, I want to give you a brief overview on what the ISA is and 3 benefits that can help you really take your assessments to the next level. So we first need to understand what the ISA is. Now, the main intent of this video is to provide you a brief overview of it. If you really want to dive deeper, I would encourage you to check out the Performance Redefined course. So the infrasternal angle, otherwise known as the ISA, is the angle that's created from the lower rib cage as it comes up and meets the xiphoid process. Now, we can have wide or narrow ISAs. We'll classify a wide ISA as an angle that is greater than 90 degrees. Conversely, we will classify a narrow ISA as an angle that is less than 90 degrees. The first way you can use the ISA is to understand spinal orientation. Now, how many of you have performed an assessment with your patient in supine and noticed a left rib flare at the lower left rib cage compared to the right? Well, what do you do with that information? Do you see it and move on? Do you think there's weak muscles? Do you think there's breathing dysfunction? Well, what I want you to do is increase your awareness of this ISA and understand that as you see that left rib flare or the left opening, that patient is telling you that they are moving to the left. Remember, the ribs are connected to the spine. So when you're getting that overview snapshot of your patient in supine, and you see this left rib flare, they are telling you that they are compressed on the right and they are rotating and opened up on the left. Now, that's going to be really useful information to carry through to your exercise prescription, right? The other thing that is really important to understand by that is when you see this left rib flare and when you see this shoulder lower on the right, when you go to check shoulder flexion, what do you think this is going to be compared to this? This is going to be limited. This is going to be normal or hypermobile, right? Why? Because they're starting in different positions. This is going to run out of space, this shoulder, as you go into shoulder flexion, quicker than the left because of starting position. So again, that left rib flare is telling you the rotation. It's also going to start to key you in as to how that ISA, that opening of the ISA, is going to influence your range of motion measures as it relates to the shoulders as well as the hips. The next way we can use our ISA is to understand movement expectations. That means when your patient is in supine and you look at their ISA, you will quickly know what they're good at and what they're bad at. Before we get into how that exactly works, let's understand it with a little bit of an easier analogy. I want you to think about a Lamborghini and a smart car. Now, when I said those two cars, you either consciously or subconsciously created expectations. You may have thought that the Lamborghini is fast, expensive, and bad on gas. Conversely, you may have thought that the smart car is slow, good on gas, and inexpensive. Either one of those can be looked at as pros or cons. It just depends on the intent as to why you would buy or drive that car. Well, the same expectations can be said for our wide and our narrows. This occurs because there's different shape changes throughout the thorax and the pelvis that then influences how our shoulders move, how our hips move, and in general, how the body moves. So for our wide ISAs, we would expect them to be better at internal rotation, adduction, and extension. Conversely, our narrow ISAs, we would expect them to be better at external rotation, abduction, and flexion. So this means that if you're checking shoulder range of motion for a wide ISA, we would, in general, assume that they're going to have internal rotation measurements that are within normal limits compared to external rotation. And just the opposite can be said for our narrows. However, there are instances because of postural deviations, because of poor breathing patterns, because of poor movement patterns, that we start to develop secondary compensations. Now, to understand this better, let's go back to our car analogy. Let's say that the smart car actually has a Lamborghini engine inside of it. When you walk up to that smart car and you just see it, you'll still have your normal expectations. It's not until you lift the hood and see what's inside that you'll then see there's modifications. Well, that's exactly what is the same for our wide and our narrows. They're always going to have that expectation. Once you start investigating through your assessment measures, you may find that they have limitations that aren't exactly as what you would expect. The final way we can use our ISA is to improve respiration strategies. Now, whether you realize it or not, your patient's range of motion restrictions at the neck, shoulder, and hips are directly influenced from their breathing patterns. Their breathing patterns hold them in their pattern, and again, when they come to you as a physical therapist to help them get out of pain, you are trying to disrupt their pattern, right? You're trying to create a new pattern. So our wides are going to breathe a certain way, and our narrows are going to breathe a certain way. At the end of the day, we need to improve our patient's movement variability. We could also say breathing variability. So what that means is we need to expand what is compressed, and we need to compress what is expanded. Now here's the thing, it's pretty easy because our wides and narrows are just the inverse or opposite of one another. So for our wide ISAs, they are going to have overcompression at this anterior chest, or what, the pump handle, right? And this upper thorax. So when I say compression, we're just talking about concentric muscle activity. That pressing is going to push everything down, and as a result, we open up the ISA. So compression, expansion. So what do we need to do? We need to compress, we need to expand, right? So a lot of times these wide ISAs will be big time belly breathers, right? Because this is where their least resistance is. But at the end of the day, your patients need to expand their lungs, right? So we need to get them expanding three-dimensionally. So we need to help these patients expand the pump handle and compress the bucket handle. Now, an easy way to do that is to start them in side lying, right? Get them in that compressed position at the bucket handle and start to work on improving their movement variability. Next, our narrow ISAs are just the opposite. They're going to be expanded at the pump handle and compressed at the bucket handle. So what does this mean? This means that we need to work on expanding here and compressing here, right? Because at the end of the day, when you breathe, the bucket handle needs to be able to expand and compress. We don't just want it compressed, right? Although a result of that compression is usually more expansion here and less of the belly breathing. So again, when you're working with a wide or a narrow, we need to start providing and giving them the tools to get them expanding where they're compressed and compressed where they're expanded. Thank you so much for watching this video. I truly hope that you found it helpful and start to bring the ISA into your assessments. Now, I wanted to remind you that the main intent of this video was to increase your awareness and to show you the power behind the ISA. If you really want to take it to the next level and start to bring this into your assessments, your exercise prescription, and your overall programming, then I would encourage you to check out our Performance Redefined course. This is our 8-week online movement mastery course. We will dive into topics like this and a whole other array of topics to continually raise your standards to bring you to that movement expert level. So again, I'll leave the link below if that's something you're interested in. If not, thank you so much for watching. I appreciate it, and I will see you guys on the next video.